Good morning, everybody. I am Shannon Rohrer-Phillips, the founder of the Voice and Visibility Women's Summit, and I am here with my team, Ashley Salmons, who's the production coordinator, and Karina Herrera, our intern. And we are really grateful to have a conversation with our first keynote speaker of our Voice and Visibility Women's Summit, Natasha Chen. Natasha, thank you for joining us, especially right now. We really appreciate it. We want to begin with, our intent. We're starting a conversation with female leaders across all sectors. We're staying true to our mission of elevating diverse voices to and through the coronavirus pandemic. And so my first question for you is on a much more personal level, because I've been thinking about you. I want to know how you're holding up, particularly in light of what we just learned, the loss of one of your dearest mentors, Maria, this week. I'm sorry. We want to start with just expressing our condolences.
Thank you for saying that. Maria Mercator was really someone, I think this, one of her colleagues said it best. It's really hard to be someone that everyone loves, but Maria was one of those people. And you could tell by just the outpouring of messages from everyone in the journalism community that she was just someone everyone treasured, because not only did she have a way of sort of shepherding you through the professional space, she also really took care to ask you about how you were doing, about the personal things about yourself. She went out of her way to learn and to check in on. So she looked at you as a whole person. And I think that's what a lot of people will miss. I've also just within the last 24 hours heard about another former colleague who's now in ICU. So unfortunately, my experience is not going to be unique here. Everyone across the country is going to be touched by this in some way. And I'm afraid, unfortunately, that a lot of people will have stories like this, where they know someone who's sick, where they know someone who's passed. And really it's touching everyone, especially those people who know folks in the healthcare industry. Those folks are working so hard.
Right, and I agree. The team and we were talking, I had a 30-year-old niece from Brooklyn that was in the hospital this week that tested positive, that probably strong, healthy, someone we would not imagine. And so we, my family and I, were walking with her virtually through that experience. And so I think part of what I wanted to hear, you've been reporting all over. You're based in Atlanta. Are you still out in the field, or are you doing everything virtual now?
No, everything is virtual for me. Some of my colleagues are in the field, and those people are in places where there are hot spots. For example, in New York, one of our colleagues, had a special story the other day just featuring what is actually going on inside the hospital. And that was, it's a story that many nurses and doctors have been asking us to show the public exactly what's going on inside, because it is so frightening. They are dealing with an unprecedented situation with very little to protect themselves. And of course, our team always takes special precautions for the crew, as well as not getting in other people's way who need to do work.
Sure.
But, our teams are being very careful across the country about not traveling unless it's absolutely necessary. So each of us have sort of an in-home setup right now. I'm using my, in-home tripod at the moment.
Sure. We can relate. It is what it is. And it sounds like Atlanta, where you are now, is becoming, are they calling it a hot spot, or your numbers are starting to surge in Atlanta? And do you anticipate they'll send you out into the field now that it's literally in your own backyard?
I think we'll see what happens. In Atlanta, it's hard to say. I think that our city leaders and the regional leaders have talked about the potential of running out of resources in the hospitals within a certain amount of time. And of course, no one can predict when that moment is. Right. The urgency is just to try to not let that happen, to get the supplies needed, to get hospital space, hospital beds. And that's the same in a lot of cities, wherever you're living and wherever people are watching this are living. It's the same story.
And tell me, so, because I agree, I think this universal truth and reality now is that everybody has to focus on their imminent health and safety. We're all going to start to be touched by this in personal and professional ways, obviously, with so many different things being shut down to
Right.
prevent the spread. Can you tell us about some stories that, even in the midst of this very real and profound crisis, share some light, some particularly, we're all about female leadership. Are there stories and industries and sectors that you think, wow, these are heroes stepping up that I'm not even sure people realize how hard they're working to keep society, hospitals, communities safe?
Well, I think in Atlanta and in many cities, we're being told about small businesses who have had to shut down because of all this, but are finding ways to still help their neighbors. Um, and that may mean cooking for healthcare workers instead of cooking for the public. And even on my own next door neighbor app, I'm seeing there was one woman at our local Trader Joe's. She works there and was putting out a call, which of you seniors need groceries, may be afraid to go out. Let me get that for you while I'm on the job, and I'll leave it at your doorstep. Little things like that have gotten such a response because it's just an indication of, being human and being each other's sisters. And beyond that, some of the stories you probably have already heard, but I'll re-highlight here. For example, we had I saw a Facebook live stream from a nurse here in Atlanta, and she was just live streaming after a really tough shift that she had. And I think she wanted to let the public know, especially her own family members, perhaps, who were, questioning what's really going on. And she wanted to tell them what it was like. So she just kind of walked through what her day was and explaining there are young people in real serious health trouble coming into these hospitals. It's not just something that affects 60-plus-year-old folks.
Right.
And she was showing them the masks she has to rewear. And one important point she wanted to get across in that live stream was that this is a virus that is touching everyone. It doesn't matter what race you are. Mm-hmm. I don't know if people had misconceptions out there of this touching particular sectors of the public, but she said, black, white, young, old, this isn't exclusive to anyone. That everyone.
That's so remarkable, Natasha, because I heard, and I think I saw you, the nurse you're referencing, talk about and the critical nature, and this is what happened with our niece, of having someone healthy and otherwise in great health go into a respiratory distress scenario can be really frightening. And so I think, to your point, it's time for all of us to gut check and to really double down on what can we do to ensure safety. And I think I want to talk more about the healthcare workers, because I agree. My career, I started as a medical social worker, and I think to the units right now, I think about the charge nurses. I think about the medical records teams. I think about housekeeping services and food and nutrition services. And it's such an ecosystem of helpers, and they're always there for us. And until a crisis like this hits, and we start listening to those female and male and diverse healthcare workers, I feel like that's something that could be a call to action. How can those of us that are wondering, what can I do? How can we look to our local and regional healthcare leaders? And whether we've seen groups here, BSwanky is one of our sponsors, and they're usually luxury handbags. And Ashley, aren't they making face masks now and donating?
Yeah, they're all making face masks. Mm-hmm.
So we're seeing evidence of that. And I think if we can all creatively imagine, can we feed our healthcare workers? Can we assist with masks and supplies? I mean, are there other acts of kindness, Natasha, that you see in the field by listening to those, I think, in that healthcare space that general population can do to assist?
Well, I think it's important to check with your local hospitals to see if they have a particular call or a need for something.
Yeah.
There have been people asking me, do you think that my hospital would accept, an opened box of masks? Well, it depends on the hospital, I think. It depends on what they are specifically needing at the moment. In that particular person's case, they were asking about a Seattle hospital in Seattle where I used to live. And so I was able to check with the Seattle hospital they were referring to, and it turns out that they didn't want opened boxes of masks. They wanted, unopened ones.
Yeah.
Little things like that. So just check with your hospital's website first, because they're all really busy.
Sure.
And some, I think in the Georgia area, are asking for people's homemade masks that are out of fabric, but others are not asking for that because they're really focused on the N95s.
Sure.
So it really depends on what your area is asking for. But like you said, I think a lot of it is pretty simple when it comes to feeding these people who are on their feet for God knows how many hours.
Right.
So these restaurants are opening their doors, caterers are opening their doors to them on breaks or after work.
Mm-hmm.
I heard of people donating food and leaving it at the hospital.
Right. And we just love like those stories. And I know you met our community here in Sarasota, Florida, and we have the Sarasota Memorial Hospital and their foundation came to the summit. And so again, I would call our local listeners to reach out, to folks in that space, particularly I would say the advancement and the foundation folks, because they're not on the front line treating clinical patients, but they're there to look at resource allocation and support. And those are ways that I think folks that are interested in how can I help could.
And I want to add, I think that there are ways also to help local school children who are typically low income and rely on free lunches and such. I know that there are organizations and the schools are figuring out how to still feed them, but you might want to check with your local school district too, to see if there's a way to support those kids and those families. And same goes for nursing homes. They are very critical, vulnerable populations. And if there is something that you can do for them to leave on their doorstep or anything like that, you might want to check with them.
Well, that's why we love you, because we agree. We partner here with, of course, my husband runs Visible Men Academy and is over at the school every day. It's a Title I school, so they're accepting food donations and their team is working around the clock to provide support and resources. But both counties, Manatee, Sarasota, and all throughout Florida, and across the country, we have an abundance of low-income children who, to your point, Natasha, need food access, they need technology access, and I think we also just need to find continued acts of kindness through this time. So I know you've got to get back to CNN, and we just want to thank you. We wanted to tell you that our Voice and Visibility team and family is watching you on the news, but we're also we're here praying for your health and safety and your heart as you navigate it.
And I am doing the same for all of you. And in terms of highlighting fabulous people and fabulous women, I do want to also mention that there are a bunch of immigrant doctors in this country. I just did a story about them who have a hard time sometimes relicensing here for various reasons that have to do with restrictions and rules in the medical industry here. They want to help and they are trying, and sometimes they're on the sidelines. One female doctor from Iraq actually was one of my interview subjects, and luckily she matched into a residency. She's going to start in July, but until then she can't help out, even though she's skilled and has worked in emergency rooms before. So thinking of those people too, who are battling not just this pandemic situation, but also the immigration process and red tape and, that group among all the healthcare workers. I really
and the barriers. No, I'm glad. We'll check out, for those of you that follow Natasha's social media, we'll also share some of the work she's doing in the field to make sure that we're elevating and proliferating kindness, humanity, and female leaders that will continue to guide us as we all navigate this unprecedented time. So thank you, Natasha. Be well. And we'll be in touch soon.
Okay. Take
Bye.
care.
Bye.
Bye. Nice talking to you.
You too.